All right, everybody. Thank you very much, EIM Global Network. It's great to see so many faces. This is just an outstanding turnout already. Thank you so much for joining us from whatever part of the country or world you are in right now. So today's webinar is really dealing with strategic planning, and Robin is our expert and going to lead us through this. And just a small intro to that is we did this, it was either last year or the year before, we did a webinar on this leading into the end of the year. And at the end of the year, we always ask each country to fill out the annual report. And within the annual report, we say, well, what are your goals for the coming year? And at ACSM and with us at EIM Global, we think that the annual goal setting and strategic planning is so important, so vital. It guides everything we do, that we really wanted to keep trying to support you all in making the same efforts. And so much so, and I think Robin will speak about this more, that she went to our EIM governance board and the ACSM leadership and said, it's so important. I want to help incentivize EIM national centers to engage in strategic planning. And she goes, if we can get countries to do strategic planning and really work on this with their advisory boards, will you give us ACSM memberships? And they agreed. First time in 12, 13 years of EIM, we are going to provide one free ACSM membership to every country that completes a strategic planning process and submits the documentation. So as part of that, we wanted to make sure we provide the structure and support to help you engage in this process, hence the reason for today's presentation. So we're going to try and make this really hands-on and active. And with that, Robin, let me turn it over to you.
Thank you, Mark. That's a great introduction. So yeah, we're thrilled to be able to offer this extra benefit. And this morning morning for me, I don't know where it is for you around the globe, we wanted to give you a chance to actually do a strategic plan for one area of work that you might want to focus on for 2022. So I'm going to be stopping periodically and asking you to fill out a section of a form that Mark sent to you. Mark, right? You sent them a form ahead of time?
If I didn't, I might not have. I'll put it in the chat box for everyone to download though.
Okay. Or just do it in your head. So we're going to stop periodically and I'm going to say, now you do this for your team, your national center. So let me share my screen here. Okay. So just to remind you, this is our vision, and that's the first step in building a strategic plan, is being clear about what your vision is so that you focus your efforts directly to achieving it. And the vision of Exercise Medicine is to make physical activity assessment and promotion a standard in clinical care. Always happens, integrated into the workflow, integrated into clinical practice. And then to connect healthcare with evidence-based physical activity resources for people everywhere and of all abilities. And this can be done by referring patients to programs, to professionals, to places where they can be physically active, or providing them with self-directed resources, whatever it is that works for the clinician, but most particularly for the patient or the individual that you're trying to be active. And so the first thing that we did with Exercise Medicine is we said, well, if we want to achieve this vision, what are the fundamental areas where we need to do some work in order to achieve that vision? And at Exercise Medicine Global, these were the fundamental areas that we came up with. We came up with 7. And I'm not saying that these are the ones you need to come up with for your national center, but I believe that several might be appropriate. The first one was healthcare provider engagement and education. The second was exercise professional preparation and education. So those two, have to do with the people that can provide the advice and make the recommendations. We need to get them involved, educated, and activating this in routine clinical practice. The third one was, let's connect healthcare with physical activity resources. That has been the most challenging one for us. And it sounds like that's been very challenging for many of you as well, but very important. Because ACSM is a membership association, one of our fundamentals was being able to engage or involve our members in exercises medicine. So that is one of our fundamental areas. Policy and advocacy. You know that unless you go to high levels to create policies and regulations that promote and encourage or even mandate the inclusion of physical activity, it makes it much more difficult, and you rely on individual partners and champions. So policy and advocacy, we felt, was a fundamental area for us to try to work on. Exercises medicine research, and Mark has taken the lead in this one, in that we, in order to make the case to healthcare administrators, ministries of health, physicians, and other healthcare providers, we need to have good research that supports the recommendations that we're making. And we formed the Research Learning Collaborative as part of that fundamental to try to promote research specifically on what interventions are effective in a healthcare setting to try to integrate this and to refer patients to the help that they need. And the last was you all, the EIM Global Network. We felt for us this was a fundamental area where we wanted to spread this vision around the world and invite partners such as yourself to do it in their own countries. So what I'd like to do this morning is have you stop. I'm going to stop here in a moment and ask you this question. What does your team want to work on this year? Is one of these fundamentals something that we've decided on, something that your team would like to work on? Or is there another one that you know that your team would like to work on? Once you identify which your fundamentals, then the second step is to say, all right, in that particular area, what do we ultimately want to achieve? And one way to do it is in your mind is to say, wouldn't it be great if this situation existed? Wouldn't it be great if every physician talked to their patients about exercise at every visit? What does the big picture of success look like? And that's what we call a true north statement to keep you headed in the right direction. So for example, I'm going to take you through one fundamental that Mark and I have been working on, and particularly Mark, and that is our EIM Global Network. He is our project leader for that. And the true north statement we wrote for that one is that, wouldn't it be great if, or our vision in this area is that EIM national centers fully implement EIM within their countries. And the second part we implemented for us to keep us mindful that we must respect your unique culture, your unique healthcare, education, and government systems. So this is ultimately what we want to achieve. So now what I would like to do is give you a couple minutes and ask you to identify one area that you would like to work on, one fundamental or focus area, and then write a true north statement that expresses where you would like to go. So I put the fundamentals, some of the fundamentals from EIM Global up there. And I'm going to ask you to either choose one of those or create one of your own. And I put something in here that everybody's interested in lately, and that is potentially maybe you want to work on brand awareness of exercises medicine, just an awareness campaign using social media. That might be one fundamental area that you decide you need to work on. So I'm going to stop for a second. And this is, I know, Mark, we can drop people into rooms. So can we do this? Drop people into a room and we just give people a moment to do this?
Yeah, and we can do some small group discussion. Sure. Let me start assigning everyone to rooms here.
Okay.
All right, here we go.
Okay, so Mark's going to be in one room, and I'm going to be in the other. And we're just going to ask you to say, pick one, pick a focus area or fundamental, and then write a statement that says where you want to be ultimately in that area.
Go ahead, Robin, I'll wait.
Okay, so I'm ready.
You have to accept yours.
Oh, I do. Okay, where is it? I don't see it. Oh, here we go.
Sandra, anybody left? You should have an invitation to accept to go to a room.
Oh, everyone, 4 minutes. We're back already. Let's see. I'm going to make sure Mark knows we're back. Okay. Well, while we're waiting for the other group to come back in, does anyone else want to share what fundamental they would like to work on this next year?
Hi, this is Chung Xian from Singapore.
Hi, Chung Xian. Hi.
Hi, maybe I just want to share maybe what we would like to focus on. I think 2 areas. One is public outreach and community programs post-COVID for the population. Because I think this has taken a big step back during the pandemic, and as we open up the more or less restrictions, I think that would be one area that we would want to beef up. 2 is potentially research, because we've done a lot of work on the ground, education, pre-COVID public outreach programs, working with universities, but we hope that we get more data on how to measure outcomes on some of these initiatives that have been going on for almost a good 10 years. So these are the 2 things off my mind.
That sounds exciting, and that's perfect, right? That's great. You have been in Singapore doing this work for a while, so that's the kind of research we need to show the effectiveness. cost effectiveness, health outcomes, that kind of thing. That's exciting.
Yeah, thanks.
Anyone else? Ivy?
So they are coming back.
Yeah, I see.
Perhaps I can share a little bit.
Yes, Stan.
Yeah,
Stan.
yeah, okay. Actually, you may have aware that we have an exercise medicine jockey club project going on in the community,
Yes.
helping out the diabetes and hypertension patients to get back to shape through EIM model. But one difficulty we encounter is we still find there's a gap, communications between our EIM team and the physicians, the frontline physicians, to get them involved and motivate them to get into our EIM program, because there are a lot of difficulties that frontline doctors would have a lot of problems and challenges. So perhaps my strategies in the coming year would like to strengthen more educations to communications with frontline doctors and physicians and make them recognize the importance of EIM. So I'd like to measure whether they will increase their knowledge and increase their attitudes in terms of EIM model. That's perhaps the way I'd like to do in the coming year.
Thank you. Actually, you lead into an important point. I'm going to share my screen again. And that is, once you've developed your focus area or fundamental, then you have to figure out what you're going to do to make a difference in that fundamental. So that's where you identify maybe just one or two, what we call strategic initiatives for each fundamental. And the questions you ask your team and yourself are, what one or two things can we work on to help us close the gap between where we are now and where we want to be? Maybe we can't solve the whole problem in 1 year, but what things can we work on? And when you ask that question, you have to think about, okay, what is the need in that area? Do I have an opportunity because I have a contact, or I have a program, or there's a real interest at this moment? And what is it that my team can do given our time and resources? In addition, identify what the challenges are and why. And if there's something you can do to address the challenge that's helping you get in the way. So seeking the biggest impact. So let me give you an example of the strategic initiatives we decided on under our EIM Global Network. And we do this all actually for all the other areas, but just for simplicity, we decided to work on 2 strategic initiatives. And the first is, we said, look, we want to increase the size or the number of countries that are within EIM Global and the scope of the work that they're doing, their activities and their outcomes. The second strategic initiative is we wanted to enhance the value that we provide to you from EIM Global by improving our level of support, resource sharing, and connectivity. So these are the 2 that we're working on, but we can't do everything in all of them. So we had to decide what we wanted to do in order to make those happen. The next, I'm gonna move through this and have you do this in conjunction with the next one. So once you develop your strategic initiative, then you have to say, well, how am I going to decide if I'm helpful in doing this plan, what I'm putting together? How am I going to measure success? And so, and especially objectively, and that's identifying some numbers you can measure. Where are we now? Like how many, and you guys do a great job in letting us know how many trainings you have done for healthcare providers and exercise professionals. So that's a number that you can look at to say, have we reached individuals in this effort? Or how many trainings or events have we held? Or if you're working on expanding brand awareness, what are our analytics for our social media platforms? Or if there's not numbers you can associate with an effort yet, you can track whether you kept to your action plan on time, whether you met your milestones and goals, you put together a plan. So say in February, by February, we will do this. And by April, we will do this. And by June, we will do this. That will get you to your ultimate outcome. For example, we are updating the Exercises Medicine online course for exercise professionals, and we have an action plan for the year. It's taking longer than a year. And so our measure of success is, did we do this module by this time? Did our designer put this together by this time? Are we ready for launch by this time? Have we written the landing page? We have those things that we have put together. And ultimately, we will measure how many people take the course, how many people achieve the EIM credential. So metrics are important, not only for your team, but to show others the success of your efforts. So with the EIM Global Network, our metrics are, what are the number of active countries we have? What percentage of countries complete the annual report? How many webinars do we offer as part of our support strategy to you? And how many people attend those webinars? And then we decided to put together a regular newsletter to help you share and connect. And so did we put out those newsletters like we said we were? So those are numerical things that we can measure to tell us how successful we were. So now we're going to stop another minute, and I'm gonna break you out into groups again. Mark, how long did you give us the last time? We went through it a little faster because I'm mindful of time here.
Do you want to do 10 minutes this time, Robin?
Yes, please.
Okay.
I'm going to ask you the fundamental that you identified in our last discussion. What I want you to do is think of a strategic initiative you can do, something you want to specifically work on, and put some metrics to it. What will you measure? How will you measure how successful you are? Okay, so yeah, let's break out rooms and have a little conversation about that.
So when I go here, everybody, you're going to get an invitation, and it might be different rooms this time. I'm not sure, but when you go, you're going to get an invitation, everyone. You have to accept the invitation to go to the breakout room. Okay, here you go. Jose, just did you get your invitation to the breakout room? And Juan?
Okay, I think everybody should be coming back in. Do you see my screen, guys, or do you see all of our faces? Daniel, you're on.
We see your face. We don't see
Okay.
your screen. Yeah, we are not seeing any there.
Okay. Let me share my screen here. So I'm ready when everybody comes back. Okay, is everybody back? Mark, you back? The challenges of Zoom technology. We should be getting this, we should be good by now, right? It said one of the most popular phrases of the year was "you're on mute." Okay, here we go, Mark. All right, so let's keep moving. Now, we're not going to do this today, but I want to just take you through the rest of the process. So once you've identified your strategic initiative, then it's important to identify the tactics, the time frame, and the people that you need in order to execute that. Here we go, hold on. Let's see. Okay, wait a second. I'm messed up now too. Let's see. There we go. Okay, so the questions you want to ask yourself, okay, in this strategic initiative, what options should I consider doing? What are the costs and benefits of this plan or approach? Identify the main actions that are needed. Identify one person who's going to lead this effort. You know, be clear about what support and resources you need, and put together a reasonable timeline. So I want to remind you the strategic initiatives we decided to do for the global network were 2, increasing the size and scope of the global network, and then 2, increasing our support to you. And so our action plan involved these things. The first one was respond to requests from interested countries. We decided we didn't have the capability to go out and recruit over the whole world, right? So we said, look, we will, instead of going out and trying to seek new countries to be involved with exercises medicine, we would respond and engage with those countries who reached out to us. For example, Iran. In terms of the support aspect, and helping people be more effective, we decided to offer 4 global webinars a year. We said we would offer 4 Global Connect newsletters per year, inviting you to share your stories and sharing news to help people learn more and connect with each other. We said we would try to facilitate at least 1 regional meeting virtually in each region, Asia, Latin America, and Europe. Over the course of the year. And then we would develop helpful resources that we could share with you. And Mark and I split those up based on our various areas of responsibility. So you can see that for the global network, Mark is the leader in most of these initiatives or these efforts. And I am a leader in others. And then we put together an action plan or a timeline. So we said, okay, when are we going to send out those webinars? When are we going to do those newsletters? You know, when are we going to have regional meetings? And to assess how many countries are involved and how many countries are doing what, we decided we would put together a time frame for releasing the annual survey, reaching out to you for the survey, and then collating those results and sharing them with you, and then using those to inform how we move forward. So that's something that you'll need to do as you're putting together your plan. And And then every year we do this, we reevaluate and we do this thing called plan, do, check, act, or adjust. And that is, we look back and say, okay, how did we do? Did we achieve our goals, our KPIs? If we did not, why not? So we step back and ask two questions. Do we need a different plan? Or maybe we need different goals. It's a continuous process of learning based on what we did and how it came out. So we plan, we do the plan, we check back on the plan, and then we adjust or we act on a new plan. So that's the process of continuous improvement that we use here at ACSM, and that we're asking you to use. Let's see. All right, I've got two screens, so I'm like everywhere. And so we put together a document that I'm going to share with you that that Mark is going to send around. And we're going to ask you to do your strategic planning on show all windows on that document. That's not it. Okay.
So Robin, before you jump into this, could I add one thing, please?
Please, yeah, please.
So, and I talked about this in a little bit in our breakout group, but when we started this process 3 years ago, we were getting pulled in 30 different directions. People wanted us doing work site wellness. We had, and it's not just individual people, it was national associations, work site wellness, working with medical fitness associations, working with everything under the moon. So this process really helped focus what we did. And I witnessed, Robin, when people came to her, said, no, our advisory board, our governance board selected these fundamentals. This does not fit right now. We'll circle back with you next year. And Robert, I work remote from where Robin is, but I heard that she actually printed out these documents, right, Robin, and put it all over her walls. And literally, as things went along, circled and checked and put X's on these sheets of paper to make sure she was focused on keeping her eye on the strategic initiatives and the timelines that were set. So I don't know if you want to comment on that, Robin, before we jump into the last part.
Yes, thank you for bringing that up, Mark. One of the things this has been so helpful for us is really stay on track and say yes to the right things and no to the things that we either can't or aren't working on at the moment. And that's hard because we want to do everything, right? But so that really has been very helpful. And second, a visual of this whole process is something that that I used in my office. And since we've been working virtually for the whole team at ACSM, anybody that went in my office could see along the wall, what are our strategic initiatives? What's our time frame? What are, and it's so that we would periodically update those. So for us, and for me, that was helpful. And if it's helpful for you to do that wherever you are, you might consider doing that as well. So I found the document I want to share with you. I'm going to share this now. We're going to be sending this to you. Let's see, is this the right one? I think this is it. Let me try. Okay. So we're going to send you, this is a 2-page document, and we're going to ask you to think about this and fill it out for us. Mark, what was the timeline we decided on? And this might be a little too small to see. I'll bring it up.
Well, Robin, we'll I think the plan is within the next week or so to get all this information out to everyone. And we were looking for everyone to complete this by the end of January, because it's not a process we want anyone doing on their own. It's a process we really, really hope that people will do with their advisory boards and have multiple stakeholder input to this. Now, if you're like Canada and you've done this in the last year, then you've achieved that goal and you can fill this in and you're good to go. But if you're a country that hasn't done a strategic planning, Georgie, I know you mentioned that this is something you really want to do in South Africa, then we'd encourage you to start thinking about doing this in November, December, or January when everyone comes back from break.
Okay. I'm going to stop sharing. We have 10 minutes left. So I would be happy to entertain questions or comments from everyone, and I'm happy to provide additional information offline if it would be helpful to you.
Any questions about this process so far?
Hi,
Yes,
Mark
I-
and Robin.
Yeah.
Ah,
Let's go.
Sandra.
Sandra?
Let's go Sandra
thank
first
you.
and then Stanley, okay?
Yes, I think that the only challenge for us is to, as a regional centers, probably to have one strategic planning for the regional center and one strategic planning for the national center. So I don't know what is the best way to do this is if after we receive, for example, the strategic planning of some national centers to decide what is going to be our strategic planning as a regional center or doing something in common. I don't know if we can have with you, for example, like a global center, one common or two common points of this strategic planning for the regional center, something like that. I'm not sure if I was so clear.
Yeah, no, that's a great question. Mark can work with you directly. I think originally the focus of this is for each national center. You regional center directors, then we will want you to look at what everybody is working on. This will be helpful for you, our hope is, so you can see what people are working on in the region and connect people that might be working on similar types of strategic initiatives, but set a separate goal for yourself. In terms of the region. And I would suggest, frankly, doing that after you see what everybody is doing in the region.
Yeah, and I would add to we have multiple regions on it. What a fantastic turnout today. I commend everybody. You know, your strategic planning at a national center level happens with the stakeholders within the country. Your national sports medicine, your national family medicine, your national academic institutions. If a region wants to do strategic planning, it would happen with likely the leaders of each national center. Those would be your key stakeholders. So that would be the EIM Colombia leader, the EIM Chile leader, the EIM Argentina leader. And I could see those goals being even more broad. We're going to meet 4 times a year. We're going to have virtual meetings. We're going to be, I mean, they're very, very broad goals. And they might, you know, I could see that being a situation where you do it for 2 years and then reassess because they're much more broad. But again, that's up to each region and national center. But I do think we want to see the planning at the national center level first and foremost. So Stanley, you were going to say something, and Jonathan, I see you with your hand up. Okay.
Yes, I just type up my questions in the chat room, and I'm just wondering, after the survey has been done, would there be a platform that we can take reference, take a look on what kind of strategies other national centers is going or planning to do for their countries or regions, so they can learn from
We
each other.
couldn't do that actually, so
Yeah.
that people might get some ideas.
Yes, yes, that's true. Yes.
So I'm going to ask Stanley for this, if you know the strategic planning to be done by the end of February.
Yes, sure.
You know, understanding that Christmas break is a slow period, but hopefully before or after. And then it
Yeah.
takes me a couple of months, but I can certainly collate those together and say these are the most common and these are some of
That's
the
true.
goals.
That's right. Yeah.
And if anyone wants theirs shared or doesn't mind, we can certainly share those as well. Okay.
I believe so. Yes. That'd be nice.
Awesome. Great suggestion. That was a really good suggestion. Thank you. Jonathan?
Sure. Thanks, Mark. Mine was actually a procedural thing kind of related to the discussion that Brian introduced there about the registry of exercise professionals. That's one of the priority areas that we have in Canada as well. And I was just wondering, you know, Robin, you mentioned that you're developing the course for exercise professionals. Is there an intention to, you know, A, when is that going to be out there? And B, can the other EIM programs kind of learn from that experience and even share in some of those resources.
Yeah, absolutely. Our goal is by the annual meeting this year, which is the June, that we will launch our new credential program and we will launch all the modules associated with the new course. And we would welcome, you know, if any of those would be helpful to you in training and recruiting exercise professionals, we would love it. So yeah, absolutely. And we'll all have in our global network, we'll share what's going on there as we get closer to launch, and how you guys might utilize those resources. And then I'm going to jump into, we just for the EIM World Congress, the ACSM annual meeting this year, it's scheduled to be in San Diego. With COVID, we don't know, you know, something may happen, but currently we are planning on having the meeting. We are planning on having a National Center Directors meeting if you are able to travel. And we'll be asking you, you know, if you're thinking about attending, that goes to our, you know, offering a free registration to national centers that complete the annual report. So our hope is that we will have that meeting. We will be able to see you in person, but we'll keep you posted as it gets closer.
All right. Well, you know, this is again fabulous. I know it's not convenient for everybody, but we choose early mornings because that allows people from Europe, it's their afternoon, and people in Asia, it's their evening, and we can get a majority on. So I'm sorry if these aren't the best times, but thank you so much for making time to get on here.
Thank you.
We'll send out this information. Robin is really the expert in this, and I know she's more than willing to help. I'm more than willing to help, but the end goal is we would just like to see a little bit more strategic planning and goal setting for the national centers. We really think this will help everybody as a group, and really look forward to 2022 being an even better year for everyone. Robin,
Mark, when we send out the form that we're going to ask you to complete, I will also send you the PowerPoint presentation, a PDF of the PowerPoint presentation, in case that would be helpful to you.
Is that you, Chung? Did you want to say something?
No, it's me. It's me.
Oh, Amen. Yes, Dr. Amen, go ahead.
Yeah, I'm so sorry. I just have a very simple question, and I think it might help our national center, and not only all the national center. There was a program called Exercises Medicine Ambassadors, if I'm not mistaken.
Mm-hmm. Yeah, we have. We're planning to have an ambassador training at the ACSM annual meeting, and we do have a slide deck that's associated with that program, and we have a couple of ACSM members that deliver that program. But we would be I'd be happy to talk to you offline about that.
Okay, thank you very much.
Mm-hmm.
All right, everyone. Have a fantastic day and evening, and we'll be in touch soon, okay?
Thanks so much, everyone. Great to see you.